Yes, Doc.
Okay, sorry. It's a registered, the Khula Natural Health Center is a registered not-for-profit organization. It was started in Khula village outside St. Lucia in rural KZN by two homeopathic doctors, Dr. Nicoline Portretter Steiner and her husband, Dr. Manuel Steiner. They were both living in Switzerland at the time. And that was the first of the Khula clinics. So it's a homeopathic clinic. It's a homeopathic initiative where there are
Hmm.
homeopathic doctors. Translators are employed from the community and, other staff. It's all community employed. The doctors obviously are not community employed because we need registered homeopaths to work there. And the way in which it works at Khula is that patients register and they pay 10 Rand for a consultation and their medication. That's it. They have it's a flat fee that they pay when they have the
Okay,
consultation.
sure.
That 10 Rand is not for Khula to make any money, because you can imagine we don't make much money out of 10 Rand. It's
Yeah.
so the community can feel that it's not a charity, that they are actively involved in the service. Um, I was chairperson of the professional board for homeopaths, naturopaths, and phytotherapists, seconded to
Okay.
our council, and had to go and do an inspection of Khula. And that's how I got to visit Khula KZN. I live in East London, in the Eastern Cape, and I was so inspired by the wonderful work that they do there and the way in which they serve the community that I decided to start a similar initiative in the Eastern Cape, outside East London, in Ncera village. And that's how Khula Eastern Cape was founded. So I do it under the auspices of Khula Natural Health. It's now a national.
I'm not sure if we've lost Doctor. Uh, Doc, can you hear me? I
Yes, I
think
can
we've
hear you.
lost you. Yeah, yeah, you can continue.
Okay, so we now have we have a Khula Natural Health Center in the Eastern Cape, and we also have a satellite in Limpopo.
Okay. Doc, I want you to tell us about you did say in the translators are employed from the community.
Yes.
So meaning that there is the impact that the initiative brought within the community is very much huge. I want you to elaborate on services provided by the facility and how they've impacted the community.
Hayi bhuti unjani, ndicela ubulisa kuwe nabaphulaphuli.
Yes.
So ndizothetha ngee-services iinkonzo esiza nazo siyikhula healthcare facility.
Sure.
So thina okokuqala i-employment esiyenzile, because abantu abaqashiwe abasebenzayo as ii-translators, since it's indawo of i-diversity, so sine-translators.
Mhm.
Kusebenza oogqirha bathathu, uDr Loretta, nguDr Samuel, noDr Bolobolo undim. So kube khona ke i-translators for abanye oodoctor abangakwazi ukuthetha isiXhosa, since indawo that is
Oh.
Xhosa dominated. So ke ngoku sinaleyo employment eyenzekayo, futhi services esizisayo. We have natural and complementary medicine in treatment
Okay.
and management of acute and chronic diseases. I-acute illnesses zezi ezifika msinyane ezifana ne-flu kanje, then
Mm-hmm.
simanage i-chronic ezifana neeswekile, i-high blood pressure, ezi abantu abathatha i-treatment yazo every day. So siyakwazi
Yeah.
ukufana nabo ukuthi bakwazi ukuthi baphile kanjani. Then ekuqaleni sesithatha i-consultation. Kwi-consultation yethu sizama uku-understand i-patient as a
Okay.
whole, because we take into account, as i-homeopathy, we take into account ukuthi umuntu like emqondweni kunjani, emzimbeni uphila kanjani. We also consider the emotional being of a person. Then sikwazi ke ngoku ukudibanisa iyeza okanye amayeza okanye amachiza afanelekileyo ukuze akwazi ukuziphilisa yena umuntu. Also, i-treatment options zethu include nutritional and lifestyle guidance, because ekugqibeleni ukuphile indlela esiphila ngayo yeyona i-affect ukuthi sigula kanjani okanye sibe. Okunye i-services esiziprovidayo, sinayo ne-soup kitchen eyenzekayo
Oh, that's
kwi-facility yethu.
great.
ngeli xesha abantu basalinde ukuthi bakwazi ukubonana nogqirha bafumane into eyayo esiswini. So ayiyoncirha kuphela ke esiyijongileyo, sijonge incirha kanye neziphaluka.
Doc, okay, you can continue, Doc, it's fine, it's okay.
So incirha nezinye indawo ezisurrounde incirha, njengoba ikhula ngokomnqweno wethu ukuthi sikhule sikwazi ukuvizitha kwezinye indawo ezifana neQueenstown, zonke indawo zase-Eastern Cape, ephondweni sikwazi ukujikeleza.
I want us to go back. I see that the name of the facility is Khula Natural Health Clinic. I want us to stick on that natural. And while you were explaining about the medication and the services you guys are providing within the organization, Dr. Bololo, you did mention, Dobana, you guys have Amapilisa Natural. So can you please elaborate more on that? Or I'm not sure if it's going to be Loretta who is going to explain that for us. It's okay. Fine. You can go ahead, Sisi.
So xa sithetha nge-natural ngamachiza enziwe andazi noma ndithi ngamachiza noma sisixhosa na
yes ngamachiza yes ngesixhosa
ngiyonixolela ndingumSuthu so okay ngamachiza enziwe ngezityalo kunye nee-minerals ne awana side effects incedisana nomzimba ukuthi ukwazi ukuzihilisha wona. Because ekugqibeleni sinemizimba yethu ine-cells amasotsha aziphilisa sithi xa sigula kuthi athatha into ethile just to stimulate ukuthi ukwazi ukuzihilisha wona umzimba wakho.
And I think that resonates with us in Eastern Cape. Yeah. I think that resonates us with Eastern Cape because we grew up using natural herbs. Those herbs that doesn't have preservatives, they are just natural. So hence I wanted to elaborate more on that. You can continue, sis.
So bendisazama ukucacisa ukuthi okay i-homeopathy because ngamanye amaxesha igama le-homeopathy it's something that is foreign to us asi-understand noma ukuthetha ukuthini. Okunye into endiye ndidibane nayo ukuthi xa usithi uyi-homeopathic practitioner okanye homeopathic doctor bakubuza uba uspecialize ngantoni. So it's not necessarily like a speciality kukuthi it's more like i-GP general practitioner and general practitioner I specialize with anything. So siyakwazi ukukurefera if your case needs to specialist.
Okay, that's great. Dr. Loretta, yes, do you have something? Do you want to add something?
I just want to add. Yes, I just want to add about the naturalness of the medication because of the way in which homeopathic medicine is made. And because it is a natural medication, it also is safe to use with ordinary Western medicine. So, very often people think that it's got to be one or the other. It absolutely doesn't have to be, because if a patient, for example, has got diabetes and they are taking diabetes medication that they've gotten from the Department of Health clinic or from a doctor, then we can still use homeopathic treatment to support their system so that their Western medication works better. So it doesn't clash. And that's one of the huge benefits in treating chronic diseases with homeopathy, is that you essentially strengthen the whole patient, and it increases it improves their outcomes. And it doesn't have to be that the patient has to stop taking their medication that they've gotten from their general practitioner. Absolutely not. We're not trying to replace it. We're trying to enhance it and build the health of individuals so that we can build the health of the community.
All right. If usandongena masikubulise sikwamkele nkosi ngokhetha thina. I'm with Loretta Ferrucci. She is a director at Khula Natural Health Clinic, as well as Dr. Toka Bolobolo. Doc, when you are just a doctor at the facility, right? That deals with patients. Dr. Bolobolo, can you hear me? Right. Okay. While we are trying to connect to Dr. Loretta, I want you to to rope in this question. Based on the explanation you've just made, from creating employment within the community, helping the community to make sure that they get help, the help that they need. So what would be the immediate consequences for the community if the facility closes due to the lack of fund? Because the reason why you guys are here, because we are struggling to fund the organization at this particular moment. So I want you to take us through to that process.
Yes, I mean, obviously, what will happen is the three translators and admin staff and our cleaner that we employ will no longer be employed, right? So it's a very obvious consequence. Also, our patients, most of our patients that we see in Ncera are the elderly. We treat a lot of pensioners. We treat a lot of the grandchildren and the grandpas that look after the grandchildren. And we treat conditions like chronic joint problems that they can't actually get help for at the other medical facilities. So those patients their treatment will be unable to continue, and they will have a loss of quality of life. And obviously, the ladies at the Lingalecto Soup Kitchen that we support when we are there during the month, they will also lose our support. So those are the most obvious consequences of what is going to happen should we not be able to continue.
With this a challenge that you guys are experiencing at this particular moment, are there any plans to explore additional funding sources or partnerships to ensure the facility long term?
Yes, absolutely. So,
Okay.
so just a little bit of context. The Khula Natural Health Center that started in KZN is essentially largely funded by some South African funders, private funders, as well as a foundation in Switzerland. And when I wanted to start the Khula EC branch, obviously they had no experience of me, the Khula Foundation. They didn't know whether I was serious, whether I was really going to pull it off or not. And so the agreement essentially was, and also with our regulating council, that I have to have enough funds to run the facility for at least 6 months, which we absolutely did. Otherwise, we wouldn't have started. So with the help of donors, with the help of the Homeopathic Association of South Africa, we managed to accrue enough funds so that we could definitely be open for at least 6 months. So we managed that for almost a year. And now that we have the proof of concept going, now that we actually have it going, we've got patients coming, we've got patient testimonials, we've got patient numbers. Now it's going to become easier for us to secure more funding. So there's a possibility of the funding partners that fund Khula Natural Health Center in KZN, bringing us on board into their funding budgets. As well as new funders that we are exploring. So, for example, the Lotto is somewhere that we've applied for funding for next year. And there are one or two foundations in South Africa that we've also applied to for funding. Our association, I just want to go back a little bit and just clarify that homeopaths are registered and regulated in South Africa by the Allied Health Professions Council of South Africa. And that's why we get to use the title of doctor. And our studies, we study a master's degree in homeopathy, which enables us to work as diagnosticians. So we can diagnose and we can treat diseases. We also have been trained in counseling because we take the whole patient into consideration. So our association belongs to an international association called the Liga Medicorum Homeopathica Internationalis, which is an international association of homeopaths, and we have received some funding support from them as well. So as we grow, so our collaborations with national and international funders increase. And obviously, the more we can show the benefit that we're actually giving to people on the ground and in the communities, the more it is that we can actually grow our funding. Our immediate plight was that we sort of ran out of funds to actually be operational for September, October through to the end of the year. And that's what was really driving our funding appeal. Obviously, if we can get funders that buy in for longer, that would be hugely helpful to us, because homeopathy is not part of the public health system. And that's another reason why we have the Khula clinics. Because we want to show.
Sorry, Loretta. We need to go to the news quickly. I want you to pause right there. So, and then when we come back, I also want you to respond to this question, but are there any system or support system in place for patients who may be affected by the facility? But we will respond to that just after the news. I'm having a conversation with Dr. Loretta Ferrucci as well as Toka Bolobolo. $90.6, 98.4, 99.9. Right, imizuzu matwenze ube mnyekha ngoku ibethele intsimbi yaka 10 o'clock. Ladies, we are back. Dr. Loretta, I had to stop you because we had to go to the news. I want you to continue where you left off, and then I will repeat my question right after you are done.
Sure. So, I mean, I think I was more or less done. What I was really saying is that we have potential for additional sources of funding, and that one of the reasons why we started this program and we started was not just to help the community, but was also to show that homeopathy and homeopaths can be part of the public health service, because homeopathy is really cheap. It's very effective. The cost per patient is much cheaper than it is in an ordinary government facility. And the more we can grow our Khula footprint, the more we can work together with government in order to bring health to communities that struggle to access good quality healthcare.
Doc, what support system are in place for patients who may be affected by the facility if you guys are forced to close?
Okay, so I want to start off by saying that we have no intention of closing indefinitely.
Okay, yeah.
Okay, so our plan is not to close. And we do have contingency plans in place, which we've managed to put in place. It's been a bit of a mad scramble over the last 2 months, but essentially, I want to assure you and the public that we are actually not going to close. Our appeal for funding is it's long term, but it is really in the short term to just bridge us through the next couple of months to the end of the year. So worst case scenario is that we may need to reduce the services that we offer for maybe a month, maybe 2 months, but we've got absolutely no plans to close whatsoever. So we will still be able to support the community. We're not just going to leave people hanging. That will never happen.
Yeah. Dr. Bolobolo, I want you to come back to you. You are the person osebenza nababantu at a very much close level. Did you guys break the news to them that there are chances yokubana ningavala and bathini xa nincokola nabo?
No, not okwangoku.
Okay.
But ngoba sisoloko siba khona aside sibaxelele uba there are chances zokuba singade sivale. Yebo. But ngendlela abantu abayibona iluncedo ngakhona le clinic phaya kubo, I don't think bangakuvuyela ukuyiva into kanjalo. Hence we urge the public ukuthi basincedise basisupport ukuthi ingade ifikelele ekubeni ingade ivalwe. Of which ngeke ide yenzeke ukuba ivalwe. Aba bantu bafumana like good quality medication, as well siyabanikeza i-supplements ezithengwayo bazifumana for free kuthi. So siyacela ukuthi abantu, because bazohlupheka kakhulu, and also they don't have to pay much to travel, andithi ngoku bayatravela to access i-clinic, kanti apha it's easily accessible. Abantu bayakwazi ukuwalka baze bafike kwi-facility without even paying much. So siyacela ukuthi abantu bakuthi basincede, basixhase, ingade ivalwe.
Yeah, Dr. Loretta, as Dr. Bolobolo has just said, there might be someone who is currently listening at this particular moment and they would like to assist in this crowdfunding campaign to support the facility so that you guys can continue to operate. Can you take us to the process maybe? What can one do in order to do that?
Absolutely. So anybody who's interested in supporting our cause can contact me directly, and I can give them banking details and stuff if they want that. But we do have a funding campaign that's run on the BackaBuddy platform. So it's if you put into any search engine online, BackaBuddy, all one word, it'll take you to the BackaBuddy site, and then on the top of the BackaBuddy site, there's a search function. If you just type in Khula Natural Health, I actually tested it before I came on. If you type in Khula Natural Health Center, you'll see two campaigns. One is for Khula Natural Health EC, and one is for, just a general Khula Natural Health campaign. You can donate into either of those two, ideally into the EC campaign, because it just helps us to separate the funding. So it's as easy as clicking a button. You choose how much money you'd like to donate. You can actually also donate a recurring payment if you want to, which means that every month your 50 Rand or your 100 Rand, and you can donate 5 Rand to, there's no minimum amount. Whatever it is that you are capable of giving, it goes into the BackaBuddy campaign, and once a month they pay that money out to us.
Okay. Last but certainly not least, Loretta, are there any potential plans to partner with the government, private sector, to make sure that we don't experience the same problem going forward?
Absolutely. So as I explained, one of the reasons why we have Khula, why we founded Khula Natural Health, not just in the EC, but in the country, is so that we can provide services, primary healthcare services in rural areas, and also so that we can show that we can decrease the burden of healthcare. I just want to mention a few figures. At Khula KZN, they've been open since 2017. They've had more than 45,000 patient visits. That's a lot of people that have come to a facility, and all those people who've used that facility decreases the burden of healthcare on the government services. So we are actively engaged with government. We are actively engaged with the MECs of the provinces in which we work, so that we can bring the Khula Natural Health Centers to the attention of officials, so that we can work together and we can partner.
Yeah. Loretta, we've managed to gather some information from your patients in order for them to testify. Are they ready to lose the organization? What were the benefits? What are the benefits that they are currently benefiting at this particular moment? So we will make sure that we give our listeners a glimpse, and not necessarily a glimpse, in fact, everything that they've said, but we'll do that roughly around 9:30 o'clock. So ladies, thank you so much. I wish you nothing but all the best. Have yourself a great day.
Thank you so much. And thank you for the opportunity. We really value it.
Okay, thank you so much. Bye.
Bye.
Bye.